Hello and welcome back. Today I am going to explain how to do examination of precordium in a patient. Precordium is the part of the anterior chest which overlies the heart. It comes under the systemic examination of cardiovascular system. But a full examination of the cardiovascular system includes other points as well, right from the vital signs like pulse, respiratory rate, blood pressure, as well as points from the general examination like pallor, cyanosis, clubbing, edema, as well as JVP, and several points from the head to toe examination, like examination of the eyes, examination of the hands. In this video, I'm going to cover only the examination of the precordium, which is included in the systemic examination of the cardiovascular system. Before we start the examination, there are certain prerequisites that you should know. Introduce yourself to the patient, take their introduction as well, explain what you are going to do, take their consent, and you should stand on the right side of the patient. For cardiovascular examination, it's preferable if your patient is at around 45 degrees to the bed. Like any systemic examination, here also we start with inspection, move on to palpation. Percussion is omitted in case of cardiovascular system. We straight away go to the auscultation. So let us start with inspection. इसको थोड़ा सा ऊपर कर बेटा, ठीक है? Good boy. डर नहीं ना लग रहा है? Good boy. ठीक है. Before starting inspection, you ensure that the chest is exposed. Stand on the right side of the patient. Now, in the inspection, we have to look for any deformity of the chest, whether there is any pectus excavatum or pectus carinatum. Look for any scar mark, look for any venous prominence and any pulsation. Look carefully for any visible pulsation. Now comes the turn of palpation. In palpation, we have to look for apical impulse. We have to feel for any thrill in all the areas of the heart. We have to look for parasternal heave as well as any palpable heart sound, snaps or clicks. Place your right hand on the chest like this and feel for apical impulse using your fingers. I can feel the apical impulse over here. So how will you identify which intercostal space it is? For that, we start from here. This is the suprasternal notch between the two clavicles. Go down and you will feel a ridge. This ridge is the angle of Louis. From here, the rib which is attached at this point is the second rib. Below that is the second intercostal space. And you can go downwards. This is the third intercostal space and this is the fourth intercostal space. We are feeling the apical impulse at this area in this patient. Look for any abnormal character like hyperdynamic or heaving and see how much area it is covering. Next, I'll take this opportunity to explain what are the different areas of the heart. The point where we find the apical impulse is the mitral area. This point where we find the apical impulse is the mitral area. This is the sternum. On the left side of sternum, in the lower part, that is lower left parasternal area, is the tricuspid area. The second intercostal space on the left side parasternally is the pulmonary area, and second intercostal space on the right side parasternally is the aortic area. In all these areas, feel for any palpable heart sound or thrill. Now I'll show you how to look for the parasternal heave. Parasternal heave is seen in case of the right ventricular hypertrophy. So for parasternal heave, you have to use the heel of the hand. This is the heel of the hand. Place the heel of the hand on the left side of the sternum parasternally like this, parallel to it, and feel for any movement. We can see there is no parasternal heave in this case. In case of parasternal heave, your hand you can see the movement of your hand. You'll be able to see the movement of your hand in case of the parasternal heave. But in this case, there is no parasternal heave. There are certain other methods to look for the parasternal heave. Some books also mention that you can use the ulnar border of the hand to look for the parasternal heave, like this. But this is the preferable method. Placing the hand on the left side of the sternum, parasternally, and feeling for any movement. Now comes the turn of auscultation. So in auscultation, we have to listen for the S1, S2, any abnormal heart sound like S3 or S4. We have to listen for any murmur, and we have to listen for any abnormal sounds like clicks or snaps. You have to use the diaphragm as well as the bell of the stethoscope and auscultate at every area. I'm starting my auscultation from the mitral area. Now, simultaneously, you should palpate the carotid artery. You can hear the S1 just before you feel the pulse of the carotid artery. This way, you can time the sounds. The duration between S1 and S2 is considered to be systole, and duration from S2 to S1 is considered to be the diastole. I am now listening at the tricuspid area. I am listening at the pulmonary area. Now I am listening at the aortic area. Now I will listen to all these areas again with the bell of the stethoscope. Low pitched sounds are better heard with the bell of the stethoscope. And high pitched sound better heard with the diaphragm. Apart from these classical areas, there are certain other points which you should auscultate in every patient. You should auscultate the carotids. You should auscultate infraclavicular area on both sides. You should also auscultate the axilla with the bell as well. And finally, you should also auscultate the back. Between the scapula. Aortic murmurs are better heard with the patient in the leaning forward position. So in this position, you should auscultate the aortic area again. So for the mitral murmur, you should keep the patient in the left lateral position, use the bell of the stethoscope, and listen at the mitral area as well as the axilla on the left side. If you identify any murmur, then you should time that murmur, in which period of the cardiac cycle it is. You should try to understand what is the character of the murmur. You should obviously locate the murmur, which area it is. You should also look for any radiation. And you should also grade the murmur from grade 1 to grade 6. I hope that was helpful. Thank you.